Today, Brian and I are going to show you how we make transdermal medications. We are going to be doing probably the most common transdermal that we do, methimazole, and this is going to be a 50 milligram per mil PLO gel. This is the formula that we use to follow making our drug. And then we gathered the ingredients that we need, which is a PLO base and the chemical methimazole. After that, we're going to gather the supplies that we need. We're going to be using two 20 ml Luer lock syringes, a Luer lock to Luer lock adapter, and a non-sterile cap. And then we gathered the supplies that we need to dispense the drug. And these are 1 ml oral syringes and some oral caps. Okay, the drug methimazole has been weighed out. Here's the weight sheet and the drug. And Brian, who is the head non-sterile vet medicine, is going to show us how to make it.
Alright. So I'll get my syringes that I need ready. This is what I'm going to mix the gel between the two syringes.
And the best way to put in the PLO gel is to backfill it into the syringe. It's definitely less messy that way.
So I'll start out just by adding a little bit as a base for my powder to sit on top of, so my powder doesn't cake onto the plunger part and then I lose most of what I'm trying to work with. Looks about right. We'll add my powder. And I'll stick this in and get it mixed into the gel part, once again so I don't lose powder that I'm trying to work with. Try to get it all at the bottom so we don't get air bubbles or anything, and then I'll bring my syringe up to where it stops. So right now I'm at about 5.5 mils and I need to go to 17. So I will add the rest into my other syringe.
And the 17 mils is just shows it right. So the quantity made is 17 mils.
This one.
And you're doing this in a separate syringe?
Yes.
So it doesn't lose any of the drug that's in the other syringe.
So I'm going to put my Luer lock to Luer lock connector, which means I can just use this to mix between two syringes. And then I will add the rest till I get to my 17 milliliters. So now I'm at my 17 mils, so I don't need this, so I'm going to just put it right back into our container. No drug got into it or anything.
Because all the drug is in, as you can tell, in the top of that syringe.
Yep. And now I will just mix this until I feel it's good and mixed. I usually like to count to about 20 or so.
Yep, and flips. I think policies and procedures that we have say to do at least 16 times. So 20 is perfect. And mixing it like this also kind of warms up the PLO gel and makes it easier to work with.
Alright. And now you can see it's all pretty evenly mixed into there from what it looked like before.
And if it isn't, then we just go ahead and repeat that process, right?
Yep.
Okay.
And now I will grab a different connector, which is a Luer lock to oral connector, which will allow me to fill my 1 ml syringes that the patient's going to get for them to dose out to their cap. So like before, I'm going to fill from the bottom. It'll help prevent air bubbles getting in, and it's just a lot easier than trying to fill from the top. So I'm going to prepare all my syringes, get all my plungers out so I can just go from one to the next right away.
Okay. Yeah, and backfilling on the smaller syringes are very difficult because of the smaller opening. With the other syringe we backfilled just because it had a much bigger opening and it was a larger volume. So we're going to fill from the very bottom and bring it up so there's no air bubbles.
So I have my syringe on my Lure Lock to oral, and very carefully I'll just push. It doesn't take a lot of pressure at all to get this up in there. And I'll fill all the way to the top so I don't get air bubbles, and then push it down to the 1 ml mark because I want 12 1 ml syringes for this particular order. And then I will cap it off.
All right.
And now it's ready.
And then we repeat this step 12 times. Okay, so Bryan has filled all 12 oral syringes, and now we are going to label each one of them. After labeling the syringes, we're also going to put a sticker on the formula, and this just ensures that there is a double check to make sure everything was labeled correctly, and before it gets sent out, the pharmacist will double check that. Okay, so let's just show how we label one of them.
All right. So these are just bigger labels that we cut down to size for our syringes because our syringes are so small.
Yep. And we want to make sure that the patient can see, or the patient's owner can see all of the lines so they're getting a correct dose.
So I'll go above where my 1st mil mark is, right above it, so I don't cover any of the lines, and just carefully flag this around. So now it's labeled with what the drug is, when it was made, and its strength, and then the day it expires. And then we will continue this for all 12 of our syringes.
Yep. And then they also get a prescription label on the top of their bag. So it says it twice, but we want to make sure that every unit also is labeled with what it is, what the dose is, and the beyond use date. All right, so that is how methimazole gel is made from beginning to end. And thanks for watching with us. Bye.